Could your health insurance be ripping you off? Well, it turns out your prescriptions may cost more with insurance than without it. And joining me to share how to beat the drug price problem and pay the least for your meds every single time is co-founder and co-CEO of GoodRx, Doug Hirsch. Doug, thanks for joining me.
Thanks for having me, Alex.
Let's start by talking about drug prices. Why do they vary so wildly?
Well, it turns out that there's no set price list. There's no government list or no one set price at every pharmacy. Pharmacy prices vary just like any other product you'd buy, like travel or TVs. And you need to do your homework, and by doing your homework, you can actually save a significant amount of money.
And how are those prices even set in the first place? Because it doesn't seem like there's any standard to pricing them.
You're exactly right. There are very complex contracts between insurance companies and pharmacies, and the problem with these contracts is they're very complicated, and oftentimes they result in prices that are just out of whack and have nothing to do with the cost of the product. And so you as a consumer may end up paying way too much if insurance isn't covering it, or if there's some sort of restriction, or oftentimes you can just do better without using insurance.
Well, and like I said, it may be that the copay is actually not the lowest price you could be paying for that medicine. Why is that?
Well, a bunch of reasons. First of all, the days of the $10 copay are gone. There's so many restrictions with insurance. They have very limited lists of drugs they'll cover. You may have a huge deductible. Almost half of Americans have a big deductible before they get any coverage from their health insurance. And there's all sorts of other restrictions in place that basically stop you from paying like a normal copay. And even if you have a normal copay, say 10 or 15 bucks, we've got drugs on GoodRx, many common popular prescriptions that are as low as $4. So if you can pay 4 instead of 10 or 20 or whatever that price might be, why not?
100%. It adds up over the life of taking that medicine. How do you know when you go get your medicine that you're actually getting the lowest price?
Well, the first step is doing homework. We have to start treating our prescriptions just like we do everything else in our life, where we comparison shop. And that's what GoodRx does. We take billions of prices, we bring them all together, we take all these discounts and coupons from manufacturers and from pharmacies, put them all together, make it super easy for a consumer to go in, log in, see the price, and know that they're paying a very fair or the best price possible at the pharmacy near them. And we have every pharmacy near you, every pharmacy in America is in GoodRx.
And for those who are uninsured, don't have prescription insurance, what can we do for them?
Well, people who don't have insurance are the ones who need the most help, right? I mean, drugs that should cost $4 or $5, maybe $10 may cost $200 if you don't have insurance because of the weird nature of these contracts between insurance companies and pharmacies. So if you're uninsured, you got to do your homework, and GoodRx is the place to start. Again, billions of prices, all sorts of discounts. You can save up to 80%. About 10 million people a month use GoodRx. A lot of those people don't have insurance, and even if you do have insurance, we can help you save as well.
Definitely. Only heard good things about GoodRx. We have about 30 seconds left. Doug, anything else you want to leave us with?
Just that, American healthcare consumers really have to be active. You have to do your homework. Talk to your doctor. About 1/3 of doctors actually use GoodRx in their practice because the worst kind of prescription is the one that you don't take. And we just want to help Americans find ways to save, and happily, it's working.
Very good. Doug Hirsch, thanks for your time this morning.
Thank you.
All right. Stay where you are. We'll be right back.